Welcome back to The Explainer. Today we're diving straight into something that's been absolutely dominating global health headlines. We need to talk about hantavirus, specifically spreading some much-needed toeo, Hantavirus Hanta, or hantavirus awareness. You might have seen the terrifying news about the MV Hondius. It's a Dutch cruise ship that was sailing from Argentina to Europe. Well, a cluster of severe respiratory illnesses broke out on board, tragically claiming 3 lives and leaving another passenger critical in a hospital down in Johannesburg. The culprit? The Andes virus, a seriously deadly strain of hantavirus. It triggered an immediate massive WHO response. But hey, before we let panic completely take over, let's take a breath, look at the facts, and get informed.
So, let's just address the giant elephant in the room right away. Is hantavirus the next global pandemic? Look, it is completely natural to feel a spike of anxiety when you hear about international ship quarantines and WHO alerts, but I want to rapidly de-escalate that fear for you right now. Hantavirus is an old, well-known enemy. It's literally been living silently in nature for centuries. It is not a highly contagious, rapidly mutating respiratory virus like COVID-19. Now, don't get me wrong, it's extremely serious if you catch it, but the risk of it sweeping across the globe in some massive pandemic wave, yeah, that's incredibly low.
To really understand what we're dealing with, here's our roadmap for this explainer. 1. The recent outbreak and the virus. 2. A tale of 2 syndromes. 3. Symptoms and the vaccine race. And finally, 4. Prevention. Let's get into it.
Section 1. The recent outbreak and the virus. As I mentioned, that terrifying outbreak on the MV Hondius brought hantavirus crashing right back into the global spotlight. It's a pretty stark reminder that even with all our advanced medicine, nature can totally still catch us off guard. So where does this come from? The true source is its natural reservoir. Hantaviruses, which belong to the Bunyavirellus order, by the way, naturally infect wild rodents. We're talking about species like the deer mouse in North America or various wild rats. And here is the really wild part. These rodents harbor the virus long-term without ever getting sick themselves. They are completely asymptomatic carriers. The danger to us humans only happens when we inhale aerosolized particles from an infected rodent's urine, feces, or saliva. The virus basically hitches a ride on invisible dust particles right into our lungs.
Moving on to Section 2, a tale of 2 syndromes.
You see, hantavirus is definitely not a monolith. It behaves totally differently depending on where you are in the world and which specific rodent is carrying it. We're essentially looking at 2 completely different diseases here. Over in the Americas, North, Central, and South, we deal with Hantavirus Pulmonary Syndrome, or HPS. This form aggressively targets the lungs, causing severe respiratory distress. And guys, it is incredibly lethal, with a mortality rate of up to 50%. The Sin-Nombre virus in the US is a classic example of this. On the flip side, over in Europe and Asia, they see hemorrhagic fever with renal syndrome, or HFRS. Strains like Hanta and Sol cause this version, and instead of the lungs, it primarily attacks the kidneys and blood vessels. Now, while it's still very dangerous, the mortality rate drops significantly, usually landing somewhere between 1 and 15%.
But actually, there is a massive exception to the rule we just talked about. This is crucial. While almost all hantaviruses strictly transmit from rodents to humans, the Andes strain found in South America completely breaks the mold. And yep, this is the exact strain that struck that cruise ship. The Andes virus can occasionally transmit from person to person. It is rare, and it typically requires really close, prolonged contact with someone who is severely ill. But it's this unique capability that makes the Andes strain so terrifying for global health authorities. It perfectly explains that rapid, massive WHO response we saw with the Hondies.
All right, Section 3, Symptoms and the Race for a Vaccine.
So, what is actually happening inside the human body when it encounters this virus? Well, the clinical progression of HNF/HES is honestly deceptively terrifying. Early on, it totally mimics a standard flu. You might get a fever, profound fatigue, maybe some severe muscle aches. It's super easy to just brush off. But within days, literally days, it can rapidly degrade into severe respiratory distress. The virus starts attacking the endothelial cells that line your blood vessels, making them leak. Your lungs literally begin to fill with fluid. Medically, that's called pulmonary edema, and it leads to a sudden, catastrophic drop in blood pressure and cardiogenic shock. This is why early detection and getting a patient into an ICU immediately is absolutely 100% vital for survival.
And that urgency is because right now there is no cure. Let me repeat that. There is no specific approved antiviral treatment for the pulmonary syndrome. Drugs like ribavirin, which actually have shown some use in the renal version of the disease, just don't work for HPS.
This means doctors have to rely entirely on intensive supportive care. They're using oxygen, mechanical ventilators, and in the most absolute critical cases, ECMO, which is basically an incredible machine that acts as an artificial heart and lungs outside the body. They use it just to keep the patient alive, buying time while the person's own immune system fights off the virus.
But listen, it's not all doom and gloom. There is some real hope on the horizon. This recent cruise ship outbreak has acted as a massive catalyst for research. Companies like Mabion are actively accelerating the development of a subunit vaccine right now. And what's really fascinating here is their approach. They are targeting the hantavirus's GN-GC spike complex, and they're using the exact same highly effective therapeutic design principles that brought us the subunit vaccines during the COVID-19 pandemic. So while we don't have a licensed vaccine in our hands today, the science is moving faster than it ever has before.
Which brings us to Section 4, Prevention and Protecting Yourself.
Now, pay close attention, because this is without a doubt the most important part of this entire explainer. Since we don't have a cure, our ultimate power lies entirely in prevention. I want to empower you with some direct, actionable awareness so you can keep your personal risk of infection as close to zero as possible. If you take literally nothing else away from this, please remember this. If you are ever opening up an old shed, maybe a cabin that's been boarded up for the winter, or if you're dealing with any kind of rodent infestation in your house, you have to treat that space with extreme caution. The dust in that room could quite literally be lethal.
So, how do you handle it? Here is the exact step-by-step protocol recommended by the CDC to keep yourself safe. Step 1. Ventilate the space. Open all the doors, crack the windows, and just let it air out for at least 30 minutes before you even think about starting to work in there. Step 2, and guys, this is a huge one. Never sweep or vacuum dry rodent droppings. Doing that instantly aerosolizes those viral particles we talked about, sending them straight up into the air for you to inhale. Just don't do it. Step 3. Wet the area down completely with a bleach solution or really strong commercial disinfectant. Wetting the droppings locks the viral particles in place so they can't become airborne. And finally, Step 4. Always wear rubber gloves and a proper, high-quality mask while you're doing the cleanup. Now, when health authorities respond to active, severe outbreaks, you'll see them using full hazmat suits and incredibly strict infection prevention protocols. But I really want to reassure you here, routine tourism and everyday life carry almost zero risk. You definitely do not need a hazmat suit to go camping or to take a vacation on a cruise ship. The key here is simply maintaining basic hygiene, practicing good rodent control around your property, and just knowing exactly what to do if you happen to encounter a rodent nest.
To wrap up our explainer today, let's reflect on this simple truth. Hantavirus is dangerous for sure, but it is entirely preventable just by reducing human-rodent contact. The power is completely in our hands. It's all about awareness and having a healthy respect for the environment. Which kind of leaves us with a provocative final thought, doesn't it? This virus has lived silently in rodent populations for centuries. It really only becomes a threat when we humans disrupt those environments. As our global populations grow and we keep expanding further and further into natural, wild habitats, are we really doing enough to respect the boundaries of wildlife? Are we doing enough to prevent the next great crossover event? Something to think about. Thanks so much for joining me for this explainer, and stay safe out there.